Hi, I'm Jackie from Strength Therapy, and I just got prolotherapy on my knee yesterday. I found out that basically everything in my left knee is torn except for the ACL, so I decided to do something about it. Now, one important thing about having knee rehab or knee injuries is being able to get down onto the floor and getting back up. So I'm going to show you guys a way that you can do that without further injuring your knee or just making it as comfortable as possible. One of the most important things with moving around with the knee, especially getting up and down from the floor, is to have enough support for the knee so that the ligaments and the meniscus aren't strained. So I'm going to be using my other leg to actually help support it. Now, if you haven't trained like single leg strength things a lot or balancing a lot, you might want to use a wall or a mirror or a chair or table to support yourself. I'm just going to do it without the support so you can see a bit better. But what you want, first of all, again, is my left knee that's injured. Okay, so what I'm going to do is, of course, I'm having most of my weight on my right side. I'm going to be doing kind of like a single leg squat or like an assisted single leg squat with my right side. I'm going to be using my right hand to help support me and hold myself up when I'm on the floor as well. Okay, so I'm going to hobble over to the side of it so you guys can see in the camera. I'm going to do a little bit of a single leg squat, just kind of leaning down and sitting down, squatting, keeping my body posture as upright as I can, but not focusing too much on it, okay, because I actually do want to protect the knee, and I know that this whole thing is just a little temporary thing. So I'm going to squat down. I'm going to be using both hands to turn to that side that's squatting down so I can support myself, and I just kind of catch myself gently with my hands, okay, and it's important to not just thud down and just land on your hand, because that would hurt your wrist and also your shoulder potentially as well too. So while I'm down here, I actually do want to support my knee a bit, and I'm going to do that with my other foot, because for me, if I extend my knee too much or if I flex my knee too much, I'm actually in quite a bit of discomfort. So I'm going to be using my right foot to help support my knee against gravity with just putting my foot under my calf. And that actually takes all of the pressure off my knee. Actually, it feels pretty good like that. So I would do that immediately after coming down here. Okay, so you can put your foot under your calf or under your ankle, whichever one feels a bit better. For me, it feels pretty good under the calf, so I'm going to do that. And again, this helps just lift that lower leg, so it doesn't. I don't have to use my knee ligaments to help support that. Okay, now, if I'm going to be scooting around, I'm going to still be using that foot to just kind of support that knee or that calf, and then I can scoot around a bit if I want to, okay? Because I don't want to, again, excessively bend or straighten my knee. Now from here, if I want to lay down, I can do the same thing, maintaining that pressure or that support down here in the knee, and I can just lay down however I want to. Now when you're laying down with a knee injury, it's actually best to have a rolled up towel or a pillow underneath the knee so that it doesn't have to be completely straight, and so that it has just a slight little bend. It's a lot more comfortable. Also pretty good for your back too. Now, as you saw, for me to just get up, again, I'm maintaining that support at the calf, but I'm just going to roll myself up onto my elbow and then onto my hand. You can also sit up this way, but I don't really quite recommend it because you might hurt your neck that way. So I actually recommend rolling towards the side of the strong leg, like that, okay? And then you can push yourself up from that same side hand as well too. And that gets me in a nice seated position, okay? From here, what I want to do is I want to stand upright. So I'm going to position myself so that I have my hand close to my hip as possible as I can. And now I'm going to let go of this calf, okay, and I'm going to use that strong leg and the same side hand to basically lean over to the side a bit and then push myself up, okay. So from here, I'll do it nice and slow so you can see, and I just basically stand up with that one leg, okay. So this is a good thing to practice even if you don't have a knee injury, just in case you do have any type of foot injury, knee injury, or just for a different type of challenge that you want to do as like a mobility block while getting up from the floor. Okay, so good luck with this, and for anybody who's going through knee rehab like I am, good luck and good healing.